it's not just topical versus oral argument. I want to sort of break it down and go, right, topical versus topical.
People with bald scalps have very good blood supply. They don't have a blood supply problem with the scalp. I'm shocked when people come into me to then do this. You know, oh, yeah, I bought this from Thailand, I bought this from India, I bought this from there, just online. That's a black market and you don't know who's compounding it and how well they're compounding it. There are some exciting things on the horizon, you know, in terms of treatment, some things that are potentially going to be, you know, relatively game-changing. I mean.
Hi everyone, welcome back to the Hair Loss Show. Russell, good to see you again.
Thank you, Vikram, good to see you.
I thought in today's episode we'd talk about topical finasteride. Right now I know but I want to do it in a little bit of a slant on it because I know we've talked about finasteride a lot. The concept of finasteride hasn't changed since we've started talking about it, so this mechanism is still the same. Topical finasteride is sort of the next wave of what people are liking and using in terms of topical applications. There are a lot of benefits that less systemic absorption of the medication. So it's become very popular. But I want to sort of break it down a little bit more, and I'm keen to hear your insights about it because it's not just a topical versus oral argument. I want to sort of break it down and go, right, topical versus topical, because there's certainly different formulations that are potentially coming into the market. And we get this question all the time: what's new? What's on the horizon? And I know you've recently come back from a conference overseas, and I just thought we could break that down and share the information as to what potentially is on the horizon that's new with regards to topical finasteride.
All right, so the assumption up until now is that there is a dose-response relationship, meaning that the more you put into the skin, the higher the penetration that goes into the skin. And the theory being that you get more into the scalp and less into the bloodstream, and therefore less risk of general side effects. Now that is true to a certain degree, but it's also true that the higher the concentration you put through the skin, eventually the more that will absorb into the bloodstream, right? So it's a bit of a twin-edged sword there. What recent research has shown is that the length of time that the topical application stays on the scalp increases the absorption through the skin, but because you can use a lower dose, you get less absorption into the bloodstream. So the theory up until now is that if you used topical finasteride, say 0.25%, that would be the equivalent in the skin of taking a 1 milligram tablet, but only 1% in theory of the systemic absorption. Now that's not necessarily true because there are different formulations. I mean, there doesn't exist a standardized version of 0.25% finasteride.
Yes.
Right. So, for example, some of the ones that are made up have got water as well as alcohol in them and other ingredients in them. The ones that have water in them, at least in Australia, have a 30-day expiry on them for the risk of infection, for bacterial contamination. If they have just alcohol and no water, then you've got a 90-day expiry on them in Australia. But the reality is, we find, and you've had this experience as well, that some patients who react to even low doses of oral will also react to low doses of topical finasteride. So there's clearly still in some of these patients that are sensitive enough getting into the bloodstream to give a systemic result. So interestingly, while I was away at the conference in Italy recently, I talked to a group from Canada that have developed a gel that allows slow absorption through the scalp. Now, if you think about it, we have these things for slow absorption through
for medication, oral medication,
and tablets, slow-release tablets, because you want to have a lower dose over a longer period of time.
Yes.
And one of the researches they showed me was that the longer the low-dose finasteride stays in contact with the skin, the better the absorption.
Yes.
And so the corollary of that going forward is that we'd be able to use lower doses of finasteride in a system that stays on the scalp for longer and therefore reduce the absorption again, because 2/3 of the people that come into us are scared to use oral finasteride. Yes. So this has talks to the popularity of people wanting to switch to finasteride topically. The problem, again, also is how do we get young men who are not used to doing anything in particular to use something topically for any length of time? Their compliance tends to drop away. But I think that's a separate issue to the issue of how do we deal with the very, very small percentage of patients that can't even tolerate topical finasteride?
Yes.
And I think the answer is that many people now are using slow release systems on their arm.
Yes.
Dermal delivery. So think of, on the scalp, a dermal delivery technique. It doesn't leave something obvious there where you can put a small amount of gel in with a very low dose.
Yes.
And it's the length of time that the drug stays in contact with the skin that generates this slow absorption through the scalp, which is what you want because you want to minimize that. And let's face it, people may not understand until you knock your head and cut it. The scalp has very good blood supply.
Yes.
Very good blood supply. And people with bald scalps have very good blood supply. They don't have a blood supply problem with the scalp. So anything you put on topically has the potential to be absorbed.
Yes. So I think this is really sort of it's potential uses for a lot of people, because we talk, as you said, slow release tablets are more beneficial because lower dose and their effects can
peak doses.
Yes, and then you get less of the swings, less of the side effects that you get from higher doses. It's not the same with topical, because you can't just put the topical and expect it to absorb over a long period of time, because once the alcohol evaporates, it dries, and then you just got the active ingredient, which is maybe in a powdered format, that's not going to absorb through the scalp. So you need a formulation that's going to be there for long term. And this is why this is fascinating, because it's just slowly seeping into the system, and therefore not getting the peaks that you talked about, where people will get the side effect profile associated with that.
The other thing is that it opens up, in my opinion, the possibility of a greater use of topical Dutasteride.
Yes.
Because until now, the problem with topical Dutasteride has been the size of the molecule. It's such a large molecule that it doesn't penetrate the skin very, very well. And so the idea was, well, you just have to put more in. And and then some of it will get through, and then you'll get enough in there. But that's not really what we want to do here. Yeah. So the same principle, when I talk to these research people overseas, the same principle applies to Dutasteride, which they've tested. And that is that if it absorbs in over 22 hours, yes. 22 hours it absorbs in if you use the gel, then you can use a very low dose with a very good safety profile, because you're getting very, very small absorption into the bloodstream because you're using such a small dose. It's the length of time it's in contact with the skin in a slow release formulation that determines the absorption, even with a bigger molecule.
Yes. So I think the point, if I'm just going to summarize, the point is dose matters.
Yes.
But formulation is also a key part.
And that's the problem. That's the problem we have at the moment, is that there is no properly constituted, standardized around the world formulation for these things. They're all made up by compounding chemists using different techniques, different ingredients, and some of them are, part-timers at that compounding, and some of them are full-timers at compounding. And I think it's important where you get it from. I know it's nice to get it from someone close by, to make it convenient for you, but I think you have to be careful where you get it made. And it's a similar argument to my American colleagues saying to me that the generic versions of the oral medications didn't always work as well as the branded ones that came out originally, because you just don't know what the quality control was in the generic. In Australia, for example, the regulations are very strict. So any medicine in Australia that is advertised, even a generic, has to be able to prove on testing that it's within 10% of the advertised dose. So if it's a 1 milligram tablet, it's got to be somewhere between 0.9 of a milligram and 1.1 of a milligram to even make it into the market. That's not true in other markets. Yes. And also I know people buy online overseas. I'm shocked when people come into me to then do this. I bought this from Thailand, I bought this from India, I bought this from there. Just online, it's a prescription medicine. You can walk into in those countries, you can walk into a pharmacy and buy whatever you want. Self-treatment is dangerous, because you are making an assumption about what it is that you're getting. Yeah. Right. And I really can't emphasize to you that you can find a way to get it prescribed properly at a reasonable price in your country without actually just going online and buying something that should have been prescribed by a doctor.
Yes. And we've always said that a lot. It shouldn't be about self-prescription and I've got this. I mean, my hope is that this forum is there to educate people, to give them the tools to be able to ask those questions when they're with their prescribing physician.
Well, you want the diagnosis to be correct rather than just making an assumption that what you're saying is what you get. I mean, there is a form of alopecia areata, which is which we talked about before, for this autoimmune condition where it switches off the hair follicle. There is a version of that called, a diffuse alopecia areata that for all the world looks like early male pattern or female pattern hair thinning. And it's a different condition that requires different treatment. And so making assumptions about what your hair loss is can lead you down the wrong path in terms of treatment.
So I think that's really good. I think I want to highlight again that what we're talking about is what's potentially available on the horizon. It's not available, certainly not available here in Australia, so it's not something that we
That's right. It's a research project. There are some exciting things on the horizon, in terms of treatment, some things that are potentially going to be, relatively game-changing. I mean, to be fair, our current medications are in the 30-year time frame, right?
But that's good as well.
Which is great because we've got the safety profile for it. But there is some resistance to using some of these things because of the fear of the side effects. But like most things in medicine, as we drill down further and further and get better knowledge, the treatment becomes more and more specific. And I think that when we talk about androgen receptor blockade. Now, in the past, it's not been viable for men, but it's been viable for women. But the future looks like it's going to be viable for men as well. And that's further down the pathway. It doesn't have anything to do with hormone levels. It has to do with whether the hormone binds to the receptor. So that looks like a safer alternative, on the early advice. So, there are new things coming along, but you can't get your hands on them before the research is finished. These research things are all over the discussion boards. You can read about it on the internet, and people come in and ask for it. I'll just get someone to compound it for me. Well, I'm sorry, no. Let's wait until the safety evaluation is done, and let's wait for the results.
I'm rolling my eyes because on a completely separate note, we're seeing this not just in hair loss medication, but in other fields as well. There are drugs that are currently in phase 3 trials that are showing really good results, and people are already compounding them. They haven't gone through proper, validation studies, but pharmacies are still compounding. People are buying it online, getting it shipped, and using these medications.
To be quite honest about it, it's illegal.
Yes, of course.
Right?
Yes.
It's illegal, and that's a black market and you don't know who's compounding it and how well they're compounding it.
You have no idea.
There's no, we've got plenty of things to do until it passes all its regulatory tests.
I think that's probably the sensible thing to end this on, is that there is a lot more. Trust what's there, what has got good data to support it, not what looks shiny and new and potentially beneficial.
As you said, we've got 30 years experience with these medicines. It's like if there was going to be some kind of terrible long-term effect, we'd have seen it by now.
Yeah, absolutely. So yes, I hope you found that useful. Like I said, it's something that's potentially on the horizon and could help a lot of people, and will potentially change how we prescribe our medications and how we're treating our patients medically. So, of course, when this comes to fruition, we will keep you informed. But thank you again for watching. Russell, thank you for that information.
You're welcome.
And we'll see you on the next episode.
Thanks, everyone.